good morning and welcome to the Pork Academy session on the National Swine Health Strategy. My name is Rachel Self and I'm proud to be a part of the 2024 Real Pork Scholars Cohort. I recently completed my master's degree in swine nutrition at the University of Missouri under Dr. Amy Petrie, and I'll be beginning vet school at Texas A&M this fall. My research focused on symbiotic supplementation during the sow transition period to improve fiber fermentation and cost-efficient feed ingredients to further improve farrowing and energy utilization. I'm passionate about my research because it offered a scientific solution to farrowing issues in commercial production. I hope it will benefit the pork industry by offering a cost-effective means to shorten both farrowing duration and decrease instances of stillborns. So thank you all for joining us this morning. We encourage you to scan the QR code shown on the screen and subscribe to the news from the Pork Checkoff. With that, it is my pleasure to introduce our session moderator, Dr. Meredith Peterson. Dr. Peterson joined the National Pork Board in 2024 as Director of Swine Health. She oversees the secure pork supply and certified swine sample collector programs and supports the development of a national swine health strategy. In this role, she collaborates with others on the swine health and production team on projects related to both foreign and endemic diseases. So with that, we'll welcome Dr. Peterson.
Good morning. Thank you for attending the session today. We're really excited to tell you more about the National Swine Health Strategy, and then we'll spend a lot of our time today listening to you. So we are all ears and looking forward to hearing your feedback on how we can make progress in swine health. Just going to give you a minute to review the antitrust statement before we get started today. Thank you. So I have the honor of introducing our speakers today. We are working on a collaborative project between the National Pork Board and the National Pork Producers Council for the National Swine Health Strategy. And so speaking with you all today is Dr. Dusty Odekoven and Dr. Anna Forsyth. Dr. Dusty Odekoven is the Chief Veterinarian for the National Pork Board. He leads a team of veterinarians and swine production experts to deliver on top swine health concerns for pork producers, including foreign animal disease preparedness and protecting the U.S. herd from African swine fever. Dr. Anna Forsyth is the Director of Animal Health for the National Pork Producers Council. In her role, she serves as the liaison between the pork industry and the government on pre-harvest animal health and public health issues. These include animal welfare, antimicrobial use and resistance, and foreign animal disease prevention and preparedness. So welcome, Dusty and Anna. And with that, we'll go ahead and get started.
Thank you, Meredith. And thanks everyone for coming today. It's good to see a full room here. I think this demonstrates the level of interest that we understand the topic of swine health drives. And so if you look at the words on the screen here, there's a representation of a lot of different areas of topics that affect swine health. And for the last 3 or 4 years, when we've had Pork Academy sessions like this, we've been very focused on foreign animal disease prevention, especially with the emergence of African swine fever virus and the rapid spread across Europe and Eastern Asia. And that's still a threat. It's an ongoing threat, and it's something that we still need to continue to maintain awareness of, and to continue to promote the tools that have been developed to prepare the industry to both prevent it and to be able to respond if we were to get a foreign animal disease introduction. So that's not going away. That's still important. However, we also recognize that there are a number of other issues that are affecting swine health. And there is a lot of good work going on in those areas too. We've seen the development of a number of initiatives and projects and programs dealing with swine health issues. But as we look across the waterfront of those issues, sometimes it feels a little bit uncoordinated. And so one of the goals that we have in developing a national swine health strategy, let's see, I'll just do that, And let me back up here. Again, I think the packed room helps demonstrate what we've heard through our survey is that 98% of respondents to our producer survey indicate that swine health is an important topic that they want to hear about, that they want to see progress towards improving. And so as we prepare to develop a national swine health strategy, one of the first steps that we need to take is gathering input from all of you and producers at every level along the production chain to understand what are the things that you find are most important as we deal with swine health issues. After we gather that information, we'll move into a stage in developing a national swine health strategy with our national and state producer organizations. So I'll describe that a little bit. Many of you probably understand, but there are two major national swine organizations, the National Pork Board and the National Pork Producers Council, and we work very closely in association with our state pork associations. We envision this to be a very producer-led, farmer-driven initiative to understand what the swine health challenges are at the farm level, and then to develop a high-level strategy to deal with those issues. And of course, we'll need all of our partners that are listed there, and perhaps others that we haven't listed there, that we work with on a regular basis on a number of swine health issues. So the process is rather simple. Step one is to gather producer and stakeholder input. That's what we're doing here today. We also have a survey that, and I'll talk a little bit about the process here in a little bit, but hopefully many of you have had an opportunity to give us input through the survey that is at our Pork Board booth here today. At some point in the future this fall, we'd like to convene a group of producer leaders to look at all of the data from the information that we gather through this information gathering process and to set the direction for the National Swine Health Strategy. So here's the timeline. We have been talking about this for some time. There was an advisement at Pork Forum that asked for the development of a National Swine Health Strategy to coordinate our efforts on swine health. We are in the process now of gathering producer input. We'll bring that advisory group together sometime this fall. We're looking at, it's showing there August or September. We may be even moving that into October. We want to make sure that we get broad producer input. We're not really in a race here. We need to make sure we do it right, gather the input that we need to make a decision to move forward and develop the strategy going forward. This advisory group we've assembled represents the breadth of production across our country through different geography, through different size of production. We've got contract growers, we've got independents, we've got integrated producers, show pig producers, and just a variety of different representatives on that group. A couple of state executives, the two CEOs from our national organizations, and Dr. Forsyth and myself. And we are considering expanding this group somewhat. I think as we get going here, we're recognizing the need to make sure that we're getting as broad of representation as we can. But as we've stood this up in the process, we're looking at having primarily producer leaders here that can help react to the data that we're gathering through this process and set the direction that the organizations will move forward in developing a national swine health strategy. So who are we trying to reach? Primarily producers. We really want to hear from producers. What are the issues that you're dealing with on farm? We want to know from our allied industry participants, what are they hearing? How are they working with producers to understand what these issues are and what we can do to address them? So how we're collecting this information, we've got the surveys as I mentioned. You can take those online. We've got a QR code. We've got tablets available in our booth. We'll be sending those out, sending the link out through state pork associations and other communication avenues to make sure people have an opportunity to take that survey and give us responses. We also plan on having the staff both at Pork Board and MPPC have opportunities every day to have one-on-one conversations with producers and to capture that information and understand what the issues are out in the country. We plan to have listening sessions like the one we're having today with state pork associations, with their swine health committees, with other industry events that are going on throughout the summer And if you know of an event that we might be able to attend either in person or virtually to gather that kind of input, please let us know. We would really like to be as inclusive as we can in gathering this information. And then finally, and very importantly, through our state association partners. There's a lot of good outreach opportunities through state associations. That's really where the rubber meets the road as far as producer input is through those state associations. We want to make sure that we're working closely with our state partners. What do we want to know? And I think this is really what we're going to get to today during the listening session is tell us about the present and future health challenges. So I want to prime you all to be thinking about that, because when Anna and Meredith start the listening session here, these are the questions they're going to ask you. What challenges do you have on the farm specifically? And they may be infectious disease related, they may be genetic related, they may be housing and welfare related, but things that are related to health. I think, we all understand, if you work with pigs, you understand that health challenges can mean the difference between profitability and loss, right? And you also have potential impacts to employee morale, cost of production, and so much else, okay? And so what are those challenges that are health related that you deal with? And then secondly, what do you think we could be doing to address those issues? What do you think needs to be done? Where are the gaps that we need to close? And I think by understanding what these challenges are and what the gaps are that we need to close on a broad scale, we can start to develop priorities that help lead to a strategy that will help us improve swine health. So with that, I'm going to turn it back over to Meredith and to Anna, and I'm going to go record your comments here. So thank you, Meredith.
Thank you, Dusty. At this time, I'd invite Dr. Forsyth if she has any additional comments on behalf of NPPC on the National Swine Health Strategy.
Sounds good. Thanks, Meredith. And thanks everybody for joining. As Dusty said, I think this is a good testament to the interest and the need to continue the swine health conversation. And with that, I like to maybe provide a little bit more background on the development of this effort, this project. Hopefully, you're all familiar with the 6 industry priorities on African swine fever that we've been focusing on over the last 3 to 4 years. We got to a point where we were kind of reevaluating those priorities and not wanting to take our eyes off ASF or foreign swine disease, but questioning maybe whether or not we were still focusing on the right priorities. And so as we talked about that more, we decided maybe we could broaden the scope. ASF isn't the only threat, so maybe we should consider foot and mouth disease, classical swine fever. And then we started talking to more and more producers and then decided it can be expanded much more broad than that. There are a lot of other health challenges that are affecting producers today. African swine fever, the other foreign diseases or concerns that we've got to continue to focus on, but there's a lot going on with endemic health challenges that we feel at the national organizations that we could also try to help address, and maybe more importantly, facilitate the data collection from producers who we represent, and then share that out with those other organizations that you saw on this slide. So I think that that's probably what I really wanted to emphasize here, is that through this process, not only will it guide the work that NPPC does and Pork Board, but all those other organizations. That's our goal, that's our hope. We will share what we learn from this listening session phase of this project out with academic institutions, USDA ARS, our sister organization, SHIC, AASV, to try to encourage everybody who's working in the swine health space to focus on what the priority is for producers. So with that, I won't take any more time, but thanks again for being here, and we're looking forward to hearing from you all.
Thank you, Anna.